Welcome back to my channel. In today's video, I'm delving into a critical topic, Clozapine Induced Agranulocytosis. Clozapine is a powerful antipsychotic medication, often reserved for treatment-resistant schizophrenia. However, its use comes with significant risks, notably agranulocytosis. Understanding this condition is vital for both healthcare professionals and patients. In this video, I will explore the mechanisms behind clozapine-induced agranulocytosis, discuss who is most at risk, and outline the essential monitoring protocols that help mitigate this danger. Stay tuned as we uncover the crucial information you need to know to navigate this complex aspect of clozapine therapy safely. Let's begin by dissecting the word agranulocytosis. This term derives from the Greek. A means without. Granulocyte refers to a particular kind of white blood cell, ones that contain granules. Granules are small particles in the cytoplasm of these white blood cells that contain enzymes that are released to fight infections and also during allergic reactions. Examples of these white blood cells are neutrophils, basophils, and eosinophils. Osis means disease or condition, so other examples like acidosis, atherosclerosis, tuberculosis. Okay, you get the point. It can also refer to an abnormal increase in the level of a particular cell in the blood. This can make it a bit confusing, but in this case, it means disease. So if we put it all together, agranulocytosis is a disease affecting the granulocytes, leading to a severe reduction in the numbers, putting the patient at risk of life-threatening infections. Now, even though there are multiple granulocytes, we primarily focus on neutrophils because they are the most abundant type of granulocytes and play the most critical role in fighting bacterial infections, making a significant drop in your count very concerning. Now, the reason why clozapine causes this toxicity is not fully elucidated, but several hypotheses have been proposed. First, toxic metabolite formation. Clozapine is metabolized into a reactive ion. This metabolite can irreversibly bind to neutrophils' proteins, potentially disrupting their function and viability. Next, immune-mediated response. The binding of this reactive ion to neutrophil membranes may create neoantigens, triggering an immune response that leads to the destruction of these neutrophils. And lastly, genetic predisposition. Certain genetic factors, such as specific human leukocyte antigens, HLA gene variants, may increase susceptibility to clozapine-induced agranulocytosis. HLA are a group of proteins found on the surface of most cells in the body, which help the immune system determine which cells are part of the body and which ones are invaders. It's important to note that these mechanisms are not mutually exclusive and may collectively contribute to the incidence and onset of clozapine-induced agranulocytosis. The incidence of agranulocytosis in patients taking clozapine is between 0.8% to 2%. This is much higher than the general population's incidence of drug-induced agranulocytosis. Most cases develop within the first 6 months of treatment, particularly between weeks 6 and 18. After 1 year, the risk significantly decreases to levels comparable with other antipsychotic drugs. Nonetheless, monitoring protocols have been developed to mitigate the risk of agranulocytosis. This is done through the Clozapine Risk Evaluation and Mitigation Strategy, or REMS. This is a safety program required by the FDA to manage the risk of severe neutropenia associated with clozapine treatments. The official FDA-approved REMS was in 2015, but in 2021, the FDA Advisory Committee voted to dismiss the clozapine REMS protocol, citing it as a barrier to access because of the strict monitoring and requirements, leading to the need for retitration, psychological distress for patients, physical discomfort or withdrawal, symptom exacerbation, and even hospitalization. The advisory committee stated that the neutropenia risk could be sufficiently managed without the same level of oversight. Also, not only is clozapine highly effective in the management of treatment-resistant schizophrenia, but the severe neutropenia is almost negligible after a year or two of treatment. However, as of the latest updates, the REMS program for clozapine remains in place. While there has been some conversation about loosening certain requirements, like the frequency of the neutrophil monitoring, the FDA has not yet removed the REMS entirely, and it's still mandatory. The FDA at the moment is conducting thorough reevaluation of the REMS program to determine whether it can be modified to minimize the burden on patients, pharmacies, and prescribers while maintaining safe use of clozapine. Okay, so let's go on to learn about the requirements of this program, since compliance is still required. And even if, let's say, the FDA abolished this program, we can still have a good idea of how we could approach the monitoring of these patients within our own clinical practice. The REMS program requires the provider, pharmacies, and patients to be certified in the REMS program for prescribing, dispensing of the medication, and for patients to receive it. In order to monitor for agranulocytosis, we have to specifically monitor the absolute neutrophil counts. This gives us the exact amount of neutrophils in the blood. We calculate it by adding the percentage of neutrophils that are mature, which are known as segmented neutrophils, or SEGs, plus the percentage that are immature, which are bands, and dividing this number by 100, and then multiplying it by the total number of white blood cells. A normal absolute neutrophil count, or ANC, for a healthy adult is between 2,500 and 7,000 neutrophils per microliter of blood. Now, before initiation, a baseline ANC must be at least 1,500 neutrophils or cells per microliter of blood for the general population. There are patients in certain ethnic group with a condition known as benign ethnic neutropenia, which is characterized by lower baseline ANC than we see with the general population. But I will not be covering this in the video, but just know they may have different monitoring parameters. Now, during treatment, continuous ANC monitoring is still required, which must be reported to the clozapine REMS. The reporting of the ANC is usually done by the physician, and then the dispensing pharmacy must verify these values before dispensing the drug. The ANC monitoring is as follows. For the first 6 months of treatment, weekly ANC monitoring is required. Now, because of the monitoring schedule, the maximum daily supply of clozapine that can be dispensed is 7 days. So the pharmacy can only dispense 7-day supply at a time during the first 6 months. After each 7-day period, they will confirm that there is an updated ANC and then dispense the next 7-day supply. During months 6 to 12 of treatment, bi-weekly ANC monitoring, so again, the maximum daily supply is 14 days. After 12 months, monthly ANC monitoring, which may continue indefinitely, and up to 30-day supplies can be given. Clozapine treatment should be stopped if the ANC falls below 1,000 neutrophils per microliter of blood for the general population. After that, monitoring of the ANC every 1 to 2 days is required. You must also monitor for any signs of infections like fevers, sore throat, cough, etc. If signs of an infection, you want to start broad-spectrum antibiotics like augmentin, zosyn, meropenem, cefepime, etc. You may also consult with a hematologist or infectious diseases specialist as needed. We can also consider using granulocyte colony stimulating factor, GCSFs, like filgrastim, which will go into the bone marrow to stimulate neutrophil production, and this will speed up the recovery of the neutropenia. Clozapine can be reinitiated when the ANC goes above 1,500. Patients who initially experienced severe neutropenia, so an ANC below 500, may have a higher risk of reoccurrence, and in these patients, re-challenging them should be approached cautiously and with a specialist involved. Ensure that there are no signs and symptoms of an infection prior to reinitiation. You also want to restart with frequent ANC monitoring, so weekly for the first 4 weeks, and then gradually resume the original monitoring schedule based on the duration of therapy and stability of the ANC. When restarting clozapine after an ANC drop, the updated ANC values must be reported to confirm that it meets the required threshold. Now let's test your understanding by going through a patient case. If you're still here with me, please use 1 second to hit the like button. Thank you. So we have a patient here, Homer Simpson, who's 40 years old, who's been diagnosed with treatment-resistant schizophrenia and is currently on clozapine 200 milligrams twice a day. Patient has been on it for 10 months, and patient's ANC is currently being monitored bi-weekly. Here is the ANC monitoring timeline. So patient's baseline ANC was 2300, which is appropriate. For the first 6 months, they did weekly monitoring, and it ranged from 1900 to 2400. And month 7, patient was on bi-weekly monitoring, and on week 26 the ANC level was 800. So based off this patient case, we will answer some questions. So first, what is the most appropriate action for the patient during their week 26 visit? So A, increase clozapine dose. B, discontinue clozapine because it's no longer effective. C, discontinue clozapine because ANC fell below the REMS threshold. Or D, decrease clozapine dose. The correct answer here is C, and this is because the ANC was lower than 1,000, and as per the clozapine REMS, that calls for discontinuation of the clozapine. Second question, what is the most appropriate first step after the clozapine discontinuation? A, reinitiate clozapine immediately at a lower dose. B, start broad-spectrum antibiotics without monitoring the ANC. C, monitor the ANC daily and assess for signs of infection. Or D, administer erythropoietin-stimulating agent to increase the neutrophils. Let's see what we can eliminate. D is automatically out because we use erythropoietin-stimulating agents to stimulate the bone marrow to make more red blood cells, not neutrophils. A is out because the ANC is still low and hasn't been addressed. So it's really between B and C. It's not B because we only start antibiotics if we have concerns of an infection. And the patient case did not provide any information about the patient having signs and symptoms of an infection. We monitor the ANC daily or every other day and also monitor for signs and symptoms of an infection. Third question. A few days after discontinuation of clozapine, patient begins to develop a fever plus a sore throat. The medical team is concerned patient has an infection. Which antibiotic is the most appropriate in this case? Is it A, fidaxomicin, B, narrow-spectrum amoxicillin, C, narrow-spectrum penicillin, or D, piperacillin tazobactam? We can immediately eliminate fidaxomicin right away because it's only indicated for Clostridium difficile infections, or C. diff. And based off the patient's presentation, the infection is unlikely from a GI origin. We can also eliminate B and C because we don't have a specific causative bacteria, so it is not appropriate to use an antibiotic that has a narrow spectrum activity. Instead, the correct answer is D, piperacillin tazobactam or zosyn, which has a broad spectrum activity which covers gram-positives, gram-negatives, anaerobes, and resistant bacteria like Pseudomonas. Okay, last question. When can clozapine be safely reinitiated after the ANC drop? A, when ANC recovers to above 500 and infection symptoms are resolved. B, when ANC recovers to above 1500 and infection symptoms are resolved. C, after the patient completes 7 days of antibiotics. Or D, after infection symptoms resolves regardless of the ANC recovery. We can eliminate C and D because restarting clozapine is not solely based on completion of antibiotics or infection symptoms resolution. Between A and B, the correct answer is B. So when the ANC recovers to above 1500 and infection symptoms have resolved. And that will be the end of this video. If you learned at least one thing, then please hit the like button, subscribe, and leave any comments. Thank you for watching this video and take care.